Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you some simple tips and strategies to help you get out of a chair easily and safely after your knee replacement surgery. Now, for long-term thinking in terms of getting up and down from a chair, it's going to get easier and easier to do after your surgery as your body heals, as you recover, as the pain decreases, the swelling decreases, as you build up your strength and mobility. It'll be easier and easier to the point where it will just become normal again. But early on after surgery, you might have some real difficulties. So here are a couple tips and strategies to make it easy as possible. So first of all, the chair itself, you want to make sure, if you can, if possible, the best option is a nice sturdy chair. So 4 legs or a recliner that doesn't swivel or doesn't rock up and down is ideal, just because it can tend to push you away and move on you when you're trying to get up. You don't necessarily want a chair with wheels on it, so computer chairs, things of that nature, same thing, they can move and aren't as sturdy and stable. And then also, if you're having a real difficulty, having a chair that has armrests that you can use to push up on could be real helpful too. Now I know that's not the possible for everyone. You know, sometimes you're just stuck with what you have is what you have, and that's perfectly okay too. These strategies I'm going to share will work for any chair that you're trying to get up from. So first thing you want to do is, we don't want to try to get up sitting back all the way as far as we possibly can or slouching back in the chair. You know, even if you just try right now, try to stand up, you know, it's going to be very difficult. So the first thing you want to do is scoot yourself forward in the chair, scoot your bottom up so your thighs are really off the end of the chair. And I tell people, go as far as you feel comfortable. You don't want to be where you feel like you're going to fall off the edge, but you can get up nice and pretty far up, scooted forward. So that's the first step. The next thing is the position with your feet. So if your feet are out in front of you, again, that's going to be really difficult. You want to bring your feet back as far as you possibly can. 90 degrees is good. If you can bend them back even further so they're past your knees or under your knees, that is ideal. Obviously, you might have some mobility, some range of motion problems early on, but at least bend them back as far as you can. It's all right if your heels come up off the floor as you bring them backward. Then as you go to stand, you want to do a hip hinge movement. So keeping your back relatively straight, relatively neutral posture, and you're going to hinge at the hips. Now, you don't want to curl like this, as that's honestly just bad technique. Now, if you have a walker or a cane or something in front of you, don't pull yourself up from the walker. You want to push up either from the seat if you don't have armrests, or use the armrests if you have them. So all you're going to do, you're in the good setup, you're scooted forward, your feet are pushed back, and you're going to put your hands on the armrest or the chair. You're going to lean forward or hinge, and then push right up into that standing position. And then same thing coming down, you want to reach your hands back. So if you have the armrest, reach back for the armrest, or if you don't have an armrest, just reach for that chair as you come back down to sit. Now, if you're still having difficulty, you know, you've scooted forward, you're pushing up with your arms, your feet are in the right position, the easiest thing to do is raise the height of the chair, or raise the height of the surface you're sitting on. Now, if you have a higher chair, obviously that's easy enough. If you don't have a chair that's taller or higher up, what you can do is using pillows or cushions or things of that nature. Just put them on the chair and actually sit on those cushions or sit on those pillows, and you can, you know, raise yourself up pretty high. And the higher up you are, the less distance you have to go, the less you have to push up through your muscles, and it's going to be easier for you to stand up from the chair. Ideally, as you gain strength, as you heal and recover, you want to be able to push up and stand up easily from any chair that you have or any surface that you have in your home or in your life or wherever that may be. But in the meantime, putting that cushion there to raise up the chair a little bit can be a useful strategy. I hope you found this video helpful. Be sure to leave a like if you did. Be sure to leave your comments and questions and I'll get back to you. And as always, please be sure to subscribe. We post videos on everything related to knee replacement surgery, frequently asked questions, rehab recovery, everything else in between. Thank you very much for watching.